today I'm talking about treating NAFLD, or non-alcoholic fatty liver disease, with dietary supplements. The reason that I became interested in this is because I recently met somebody who was diagnosed with NAFLD, and it was somewhat unexpected, and it was not, this person was not the typical person that you would expect. You kind of picture that as being somebody who's really heavy, or has a really poor diet, or is very inactive, and this particular person actually has a really good diet and is moderately active and not particularly heavy, so it was somewhat surprising that she was diagnosed with it, but it made me kind of interested in looking into the subject a little more. So what is non-alcoholic fatty liver disease? It's defined as greater than or equal to 5% of fat accumulation in the liver, and it excludes all other causes of liver disease, which include excess alcohol consumption, viral hepatitis, autoimmune hepatitis, Wilson's disease, hemochromatosis, and there are some medications that can cause liver disease. And it is an umbrella term that covers multiple conditions. Basic non-alcoholic fatty liver disease is fat accumulation in the liver, but there's no inflammation, and people are almost never symptomatic. Most people would not know that they have fatty liver disease unless they had some kind of diagnostic that would point it out. It's just not something you'd walk around and know that you had it. Then there's also non-alcoholic steatohepatitis, which is NASH. That's the fat accumulation in the liver accompanied by inflammation. That's also not something that most people would know that they have unless they happen to have a blood test that would show elevated liver enzymes until it became more advanced. Then you might start to be symptomatic. That's followed by NASH-related fibrosis or cirrhosis. Fibrosis is some scarring in the liver, but it's not like severe. And then cirrhosis would be when the scarring actually displaces enough normal liver tissue that it's causing a significant lack of liver function. By the time somebody has cirrhosis, they know they're sick. They're going to have symptoms. They're going to have jaundice, ascites. They're going to have nausea, symptoms like that. And then you would be diagnosed at that point if you haven't been until then. And there's also NASH-related hepatocellular carcinoma or cancer. That is actually a very small number of cases, but it does happen. So this is what we've got, what a normal liver looks like. My pointer, there we go. Versus a fatty liver. So a fatty liver is enlarged and discolored. And then we've got the slide of what a normal liver cells look like. This one is non-alcoholic fatty liver disease, just the basic NAFLD. And so all these like little white pockets here are fat accumulating in the cells. And then this one is NASH, so then we still have the fat accumulating in the cells, but then they also show inflammation and scarring. Most of the time, in order to have a true diagnosis, you need a liver biopsy, but they can also diagnose it with ultrasound, which is less invasive. It's not quite as definitive, but that's typically what they'll do unless they really, really need a biopsy. So how big is our problem? NAFLD affects 80 to 100 million people in the United States. 40, 50, 60 years ago, it was almost unknown, and now it's really prevalent. Nearly 25% of these people will progress to NASH. About 20% of those people will develop fibrosis or cirrhosis. And NAFLD and NASH can both progress directly to hepatocellular carcinoma. We don't know exactly why some people go straight from the fatty liver to the carcinoma and don't even progress through any of the NASH stages, but that does happen. And the risk, once patients have a NASH-related cirrhosis, the only thing that they can do to treat it is a liver transplant. And actually, by 2020, NASH-related cirrhosis is expected to be the largest reason for a liver transplant in developed countries. Right now, hepatitis C is the leading cause. It's expected to override hepatitis C, both because NASH and NAFLD is becoming more prevalent and because we're getting better at treating hepatitis C. So that's going down. Risk factors for NAFLD, the known risk factors, the number one is obesity. As the obesity epidemic has increased, so has the NAFLD epidemic. However, it is not, you can have fatty liver disease and not be obese. So it's not the only factor. We know that there are other causes, we're just not exactly sure what they are. Type 2 diabetes is a risk factor, hyperlipidemia, and metabolic syndrome, which is a collection of like a collection of symptoms that they call metabolic syndrome. It's increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal lipids. Suspected causes of NAFLD are hypothyroidism, obstructive sleep apnea, polycystic ovarian syndrome, extended parenteral nutrition, excess fructose consumption, rapid weight loss, and there appear to be certain genetic variants that have a higher propensity for getting NAFLD. At the moment, our treatments for NAFLD, there are no drugs approved to treat it. There are some that the drug companies are working on, but there's none approved yet. So right now, if that's what you have, your treatment options: lose weight, exercise, eat a healthy diet. That's great, right? No problem. We can just tell people to do these 3 things and we'll be good. That'll work for everybody, right? Well, if we could get everybody to do this, we would have a whole lot of health problems that would not be such a big problem. We could get rid of type 2 diabetes, we could get rid of hypertension, we could do all sorts of things. This is great, and it does work. If you can get people to consistently do this, it does reduce the chance, reduce fatty liver disease. However, obviously this doesn't work for lots of people for a whole lot of reasons. So I was looking into what are other treatment options, since there don't seem to be any right now. So my first study is the efficacy and safety of phytosomal curcumin in non-alcoholic fatty liver disease. This study was done in Tehran, Iran. It was published in February 2017. And this particular group of researchers has actually studied a whole bunch of different plant extracts and supplements and stuff and their effects on NAFLD. Their objective was to evaluate the efficacy and safety of supplementation with curcumin in subjects with NAFLD. Their subjects were adults that were referred to the gastroenterology and hepatology clinic with the diagnosis of NAFLD that was graded 1 through 3, and that's important. They couldn't be graded 0, and was made according to liver ultrasound. They did not use a biopsy for this one. They used an ultrasound because it's less invasive. Exclusions for this study were excess alcohol consumption, obviously, because then it would be alcoholic liver disease, hepatitis, and consumption of anti-inflammatory medications, among some others. They had 2 groups. The curcumin group had 50 members, and they got 1,000 milligrams a day of curcumin. It was in 2 500 milligram capsules, and they were instructed to take them twice a day after meals. The control group with 52 members had placebo capsules to take twice a day after meals. All the participants were given standard dietary and lifestyle advice before starting, and it was an 8-week trial. The measurements that the researchers took before starting were, physical, height, weight, BMI. For blood work, they were looking at AST, ALT, ALP, those are all liver enzymes, and bilirubin. And for liver ultrasound, they were studying liver size, portal vein diameter, hepatic vein flow velocity, and the NAFLD severity, which again was graded, 0 through 3. 1 through 3 was an inclusion criteria. So this is what I made this graph to try to make it look a little easier. So we have the placebo group, the curcumin group. We've got grade 0, 1, 2, 3, and then the red lines are before the study, the pink lines are after the study. So on both sides we have 0. There were no people at the beginning that had a grade 0, because they wouldn't have been included. After the study, at the end, we had 10 members. So in the placebo group, for the most part, people got worse. So we had them at grade, well, this is a super good example, but we had, for the most part, we kind of shifted to the right. There were 7 people at grade 3, then there were 11, there were 19 at grade 2, then there were 21. Now look here, in the curcumin group, we had 0 people at grade 0, and then we had 15 at the end of the study. So, 15 people got better enough to be down to grade 0. So for the most part, people here got better. So they went, 23 people were at grade 2, and then at the end of the study, there were only 6. So we got a general shift to improvement here and a general shift to getting worse in that group. So liver ultrasound showed significant improvement in curcumin versus placebo group. The ultrasonographic findings improved in 75% of the subjects in the curcumin group. And they only improved in 4.7% of the placebo group, and the results were significant. The curcumin group also showed decreased BMI, decreased waist circumference, increased hepatic portal vein flow, a reduction in liver volume. Now remember from the pictures of the 2 livers, the fatty liver was larger, so reduction in liver volume was good. Reduction in serum AST and ALT, the liver enzymes. And these changes were significant both within and between groups. So the strengths of this study, it was a randomized controlled trial. They noted their withdrawals. There were 9 in one group and 6 in the other, and all of them were due to a perceived lack of benefit. The radiologist was blinded to group assignments, and the curcumin was well tolerated. Their limitations: it was a small study size with 102 participants, pretty short duration with 8 weeks. They did not specify their method of randomization, and as near as I could tell, there was no matching of the groups for confounding factors, which I thought was a definite limitation of this. And also, they did not measure their compliance with the study protocol. We have no way of knowing whether they took their curcumin, how often they took it, how many were left. There was no mention of that at all. So based on those two things, I rated the study as neutral. Those seem pretty significant to me. So the second one I've got is a multi-strain probiotic reduces the fatty liver index, cytokines, and aminotransferase levels in NAFLD patients. This one was in Kiev, Ukraine in March of 2018. It was published in. The objective of this one was to determine if a multi-strain probiotic has a beneficial effect on NAFLD in humans. It was adults who had a BMI of greater than 25 that were diagnosed with type 2 diabetes and NAFLD based on the results, again, of an abdominal ultrasound. So we're still using ultrasound to diagnose it. Exclusions for this study: alcohol use, chronic viral hepatitis, liver disease, Wilson's disease, regular use of probiotics. Oh, this was another one for this one. If they had regularly used probiotics or if they'd had antibiotics in the previous 3 months, they were excluded from this study. So the probiotic group, there were 28 members. They got 1 sachet of probiotic per day, and that had more than 1 billion colony-forming units per dose. The probiotics included lactobacillus and lactococcus, bifidobacterium, propionobacterium, and acetobacter genera. The control group had 30 members, and they got 1 sachet of placebo per day. And all participants were counseled on diet and lifestyle changes and received mild physical training for 1 hour a day. Again, this was an 8-week trial. Again, we had all the measurements that they took, height, weight, BMI, waist circumference. Blood was AST, ALT, GGT, those are liver enzymes, lipid panel, inflammatory markers. And on the liver, the ultrasound measured liver stiffness. The fatty liver index is a calculated value. It's calculated based on, it's like a formula that's based on triglycerides, GGT, BMI, and waist circumference. So on this one, so the fatty liver index, the lower number is better. On this, we've got the placebo group, which is white, or sorry, again, the probiotic group, which is white, the placebo group is black. This is 0 for the start, and then the lower number is better, so going down is good. So, and this is percentage change from baseline. So the probiotic group decreased by roughly 7%, and the placebo group about like 1%, less than 1% from baseline. So they had about 7% improvement in their fatty liver index from baseline, and that change was significant. The probiotic group also decreased in their AST and GGT, which are liver enzymes, and the TNF-alpha and interleukin-6, which are inflammatory markers. So strengths of this study: it was double-blind. The study groups were matched for confounding factors. They had weekly phone calls to assess compliance, and their compliance rate was greater than 90%. And they had 100% completion rates. There was no dropouts. Limitations: it was a small study size with 58 participants. It was a short study with 8 weeks. Now, everybody in the study had type 2 diabetes, if you remember from the beginning. So some of the participants were on metformin, which is a diabetes med. And metformin has been shown to have a positive effect on lipid profiles and on gut bacteria. So that could have been a confounding factor in this case. And there was a lack of long-term follow-up. But I rated the study as positive. So the last one is pioglitazone, vitamin E, or placebo for non-alcoholic steatohepatitis. That's NASH, remember. This one's from April 2010, and this took place at multiple clinics around the United States. The objective was to determine if treatment with vitamin E and or pioglitazone will improve clinical and histological features in adults without diabetes with NASH. This is relevant because pioglitazone is a diabetes medication, so they're using diabetes medication to treat people that don't have diabetes to see if it will affect the NASH. And the subjects were adults without diabetes with steatohepatitis that's confirmed by liver biopsy. So this, on this one, they were using a liver biopsy as their diagnosis tool, which is more invasive but also more definitive. The subjects had to have had a biopsy within 6 months prior to the start of the study. The exclusions for this one were excess alcohol consumption, cirrhosis, hepatitis C or other liver disease, heart failure, or receiving drugs that were known to cause steatohepatitis. So we had 3 groups. The vitamin E group were 84 participants. They got 800 IU once daily of vitamin E, and they also got a pioglitazone-like placebo. The pioglitazone group with 80 participants got 30 milligrams of pioglitazone once per day and a vitamin E-like placebo. And then the control group with 83 participants got 2 placebos, one that looked like vitamin E and one that looked like pioglitazone. So everybody got 2 pills, so that helped with the blinding on this one. And then all the participants were counseled on diet and lifestyle changes, and the trial duration on this one was 96 weeks. It was quite long. So they measured weight, height, waist circumference, hip circumference, lipid panel, glucose, insulin, ALT, AST, GGT, ALP, going after all the liver enzymes again, bilirubin, and then the liver, again, they used biopsies instead of ultrasound. So the results on this. So this trial was a little weird. They used their statistical analysis. They set their p-values of 0.025 as would be significant. I didn't quite understand exactly their reasoning for that, but what they said was to be significant due to 2 planned primary comparisons, they were setting their p-value as less than 0.025. So based on that, oops, hitting the wrong button. So this is, the primary outcome was the change in histologic features of liver, so basically an improvement in their NASH. And we had 83, the number of group members in each group, so 83 placebo, 84 vitamin E, 80 pioglitazone, and this is the percent of subjects with improvement, so 19%, 43%, 34%. And the only one of these that's significant is the vitamin E versus placebo, because this is greater than the 0.025. So 43% of people on the vitamin E had a significant improvement in their NASH score. Now, both the pioglitazone and the vitamin E groups had significant decrease in ALT, AST, GGT, ALP, all the liver enzymes. However, the pioglitazone group also showed a significant weight gain over that time. On average, they gained 4.7 kilograms. Now, if you have 2 medications that both reduce your liver enzymes, but one of them causes weight gain and one of them does not, I'm thinking you probably want the one that doesn't cause the weight gain, since weight gain is one of the risk factors for NAFLD. So, and that weight gain persisted for the 96 weeks and continued even after they stopped the trial, because they did do a long-term follow-up. So strengths of the study, length of the study, 96 weeks. They used an intent to treat analysis with their statistics, and they used liver biopsies versus the ultrasound. Limitations, the study was not designed to compare vitamin E to pioglitazone. It was designed to compare them both to placebo. And because it was a multi-center trial, they had the biopsies were studied on site, and then they were also sent to a central location and studied there, where they used different cuts. And sometimes there were discrepancies between what the local site saw and what the central site saw, and so some of those discrepancies could have skewed their results. But still, I thought the study rating was positive. So the conclusions are, NAFLD is a growing problem, definitely. The prevalence of it is going up. And the treatment options right now are lacking. Diet, exercise, and weight loss are awesome if it works, or if you can get somebody to do it, but they're not feasible options for all patients. Certain antioxidants may prove to be viable alternatives, as we saw from the curcumin and the vitamin E studies. And a multi-stream probiotic supplement may also be a beneficial treatment option, as we saw from the probiotic study. We saw there were some other interesting, as I was reading through my other studies, there's some thought that the probiotics, or just like the gut bacteria, may be actually irrelevant for the obesity problem in general, like it's more than just people who are not exercising and eating too much, and it may be relevant for why there's fatty liver as well, so that might be why the probiotics have an effect even without anything else. So my references, and thank you. Does anybody have any questions? Karen?
Yeah, in both of the studies, so did they talk about kind of a broad spectrum probiotic, which strains?
Yeah, I have.
And the other thing is for the vitamin E, there's the delta gamma or the alpha, and they have all these different
They did on that one. Well, the probiotics were, it was lactobacillus, lactococcus, bifidobacterium, propionobacterium, and acetobacter. I actually have the exact amounts written down here, but so it was that was the multi-strain. For the vitamin E, they did say natural form. I don't remember exactly. It says in the study exactly what kind they used. I don't remember off the top of my head, but they used the natural form.
Oh, okay.
So.
Because, I mean, I guess this is kind of a new area for me.
Mm-hmm.
And maybe it is kind of new anyway, because we didn't know that it was a problem in the general population.
It's definitely a problem, yeah.
Right, but that it's higher than we thought, and the correlation between the fatty liver disease and the insulin, and our insulin response.
Mm-hmm.
You know, kind of based on carbohydrate consumption and fat consumption.
Yeah, and it's probably more with carbohydrates than fats, I would guess. But I mean, the thing is,
it's a combination of
yeah,
carbohydrates and fat, not good fat or not good carbohydrates.
right, yeah.
Yeah, right. So, like, do you know, like, what percentage of people with, say, metabolic syndrome might actually have NAFLD?
With, let's see, the people that were obese and had diabetes, it was like 95%.
Yeah, like pretty much everybody.
Yeah, pretty much. It was like if you start like throwing in a number of those risk factors, it was like almost all of them.
Yeah, so then I'm thinking, that's what I'm thinking it must be.
Yeah.
So I'm thinking then, how can only 5% of the population have it?
No, it was more than that. I mean,
I thought you said in the beginning only 5%.
5% fat accumulation in the liver is the diagnostic criteria.
Oh, I'm glad I asked.
Yeah.
Because I got that wrong.
Yeah,
okay.
That's a diagnostic criteria, but it varies by actual group. I actually couldn't come up with a percentage because part of the problem is, I looked at a whole bunch of different sources because I was going to have that on there, but it varied depending on the source you were looking at. Some people said it was like 10%, some said it was 25%, and part of the reason that it varies so widely is because it's hard to diagnose. There's not a prevalence because you have to do an ultrasound or you have to do a biopsy to actually diagnose it, and nobody's actually going around doing that. So they're making estimates. So depending on the source you look at, the highest percentages that I saw anywhere was about 30% in developed countries and less in some other countries. But when you get down to populations, it was like people who were, I think it was with a BMI greater than 35 and diabetes, it was virtually 100% if you had both of those things.
So based on your reading, okay, if you have these things,
Mm-hmm.
What would you say might be a good supplement program?
The curcumin, I thought the curcumin study was really interesting if they hadn't had some of those limitations to their study, but on the other hand, I haven't found anything when reading about curcumin that says it's a problem to take it. Yeah?
Based on that, when you were looking through curcumin research, did you notice any differences between types? Because there's many different forms of curcumin.
You need to take it. It's fat soluble, so if you don't take it with food, it's not going to do you any good. And there were a lot of things where they added, it's a pepper extract of some kind. There's a black pepper extract that improves bioavailability. So it does help to do that, to increase. But it's funny because sometimes people are using it for GI issues, and then sometimes you actually don't want it to absorb. You want it to stay in the GI system, and so that's a balancing act too. But so yeah, I mean, definitely you need to take it with meals because it's with fat soluble. It's not going to help you if you take it on an empty stomach.
And I noticed the form that they used in your study. That's like one of the better types at this point. So I think that's a key point to bring across, that not all curcumin is the same.
Right.
So I know I often have clients bring in supplements, and they're not even the forms that have been researched to show benefit.
They're probably the cheapest ones they can
Correct.
find. Yeah. So yeah, that is a good point. It matters which type you take. But that's kind of true of all supplements. So.
Did you come across any studies that looked at treatment once the patient's been diagnosed with NASH?
Well, which one was it? The last one was with the vitamin E was for people who had already been diagnosed with NASH.
Okay.
And I think the one with the probiotics, because we're talking different countries and how they categorize what they're doing, I'm not sure if their NAFLD categories, like their grade 1, 2, 3 or whatever, might be the same as what NASH would be in this country. So, but some of them actually did reverse or reduce the inflammation. So I think basically anything that you do that can reduce the inflammation will help. The probiotics I thought was really interesting because there were some other studies too. There are actually quite a few studies of probiotics with like mice and rats. That was the only human, and there was another human study with children, which also had really good results. Children with an AFLD with probiotics. Yeah, I know, but that study had good results with the probiotics as well. And that was all they did was do the probiotics. So I think that would work well too. That's why I find that really interesting. So that's why, I mean, it's more than just the obesity if probiotics helps. So. Any other questions? Good. One more question.
Your first study was from Iran.
Yes.
Is that a problem in the Middle East?
I don't know, but that particular group of researchers must be really interested in this because they have a whole bunch of studies about, like, they had like artichoke leaf extract, and they had like, which also was a really good one, and they had some different vitamins and some other things. So like that, originally when I searched, I came up with a whole bunch of studies, and they were all them. And I'm like, okay, well, we have to find somebody else. So, so they must just be really interested in this because they're trying a whole bunch of stuff. Yeah.